This is going to be a discussion regarding the introduction to measurement and rehabilitation practice. So, some of the objectives of this will be to recognize the value and the importance of classifying individuals and clients in the future using some of the international classification of functioning terminology, which is body function, body structure, activity, personal factors, environmental factors, all that can influence somebody's participation in activities. We also need to learn how to evaluate, interpret, and document client goals in clinical practice using a client-centered approach, and use the resources to assist in outcome measure selection, and including the use of online databases to find assessment tools and interpret their measurement properties and the validity of that test instrument. We also want to make sure that the measurement properties and the outcome measures are useful and they're valid, reliable, responsive, and have good clinical utility. So just to break that down a little bit, if you are going to measure somebody's weight, the use of a scale would be a lot more valid and reliable than if we perhaps just picked up the person. So you can see that there's different ways to measure things, and some ways of measurement are way more valid and reliable than others. Responsive means that the tool is measuring what it's intended to measure. So if we really are looking at depression, is it measuring depression or is it measuring something else? And then clinical utility is how practical is it? Is it easy to administer? Is it easy to score? How long does it take to fill out? How much burden does it put on either the provider, which is the therapist, or the client if it's a self-report measure? We also want to talk about how useful it is and what strategies can be used to facilitate the use of outcome measures in clinical practice, and talk about some of those barriers that can stop some clinicians from using outcome measures in clinical practice. And then we want to make sure that there is a thorough understanding of how essential it is to measure outcomes so that we can justify the care we provide. So we're going to just talk a little bit about some definitions and measurement benefits, barriers that can be available, and then I want to talk about the International Classification of Functioning, otherwise known as the ICF. So what is an outcome? Basically, it's a measurement, and we're measuring something like perhaps grip strength. It might be measuring somebody's participation. It might be measuring basically what the intended result of an intervention, a therapeutic intervention is. So an outcome is a quantifiable measurement of either somebody's pre-activity or post-activity participation. So an outcome measure has been validated for the most part. They are standardized tools that have been found and through clinical research to be useful to identify and quantify a client's performance based on their answers to the questionnaire. So we want to use these for a lot of reasons. For one thing, most documentation systems nowadays require the use of outcome measures. Medicare requires the use of outcome measures once every 10 visits to ensure a patient is meeting goals. It also helps to demonstrate the usefulness of actually occupational therapy and make sure that if your client is getting better, we can justify it. But if your client is not getting better, then we either need to modify a treatment plan or perhaps stop treatment altogether. So they can, of course, establish a patient's baseline status. So if you're looking at how long someone can perhaps what their grip strength is, or how high they can raise their arm, or if they can dress themselves, we can't just list that the patient has requires maximum assist. What can he do? What can he do? It needs to be very specific. It also can then, if we've taken that, if we said initially the patient could not button his shirt, but now he's able to button large buttons using both hands, that can demonstrate progress. So it can help to show that the interventions are effective based upon the plan of care that's established for each patient. It also helps patients to understand their progress in a quantifiable manner. So a lot of times patients don't really understand because they're with themselves all the time. They don't see where they've started and where they've come to. But if you can say, hey, initially your score was a 50, but now your score is a 20, that can really help to demonstrate some good gains and make them continue to be motivated to come to therapy. It also helps to inform the reimbursement payers of the system that their money that they're spending on this patient is worthwhile. And it also helps researchers or even clinicians gather data to show that care has been provided and the care has been effective. So here's just a kind of a summary of all of that. It helps to show accountability for the therapist to show, hey, I've spent my time with the patient, but this is what the results have been. It also helps efficient communication between healthcare providers because you can talk about the score. It also shows to the patient how effective treatment could be. And it also, for those payers, like we talked about, they want to make sure that their money is being spent and there's a countable change that's happening. And lastly, in research, it helps to show how the trial or whatever the intervention of the research experiment was, how effective it is. So some of the facilitators of outcome measurement, the individual needs to have a positive attitude to measure and change and convinced of the benefit of using an outcome measure. There is also some flexibility. There's a lot of different outcome measures that are available. There's an entire website called rehabmeasures.org that contains hundreds of outcome measures and their measurement properties. It also, they have to be practical, and which means that basically if I'm going to sit down with a patient and I have a half an hour to do an evaluation, I don't want to spend all that entire time just using one outcome measure tool. There's a lot of things I want to do. And again, it helps us to show what we're doing is effective. So there are a lot of outcome measures. Like I said, there's an outcome database called rehabmeasures.org. There's also a database that is provided by the federal government called PROMIS, PROMIS, which has a lot of outcome measures because the government wants us to use standardized tools. So it's also important that many organizations understand the value of using outcome measures, and like I said, Medicare requires it these days. And there also needs to be some guidance regarding the selection of an appropriate outcome measure tool and how to score it and how to interpret those results. So there are some barriers to outcome measures. Again, some outcome measures tools, one of the really good tools that we're going to talk about at some point is the Canadian Occupational Performance Measure, but it can take up to an hour to score, and so that can be a barrier at times. There's also, if you don't know of a lot of outcome measures, that could limit your ability to select the correct tool. There's a lot of them to choose from. Some of them require a cost to administer or to use the score form. There also that sometimes, and this is not for new practitioners, but sometimes you might find this in your clinical experience, that if you've been with a therapist who's been a practitioner for a long time before outcome measures were really brought into play, they may not feel like they're beneficial, that they didn't use them before, so why do they need to now? So sometimes there's a cost, but a lot of outcome measures really don't cost anything. They're readily downloadable on the internet. So again, that there just needs to be a lot of more understanding how important they are for us as a profession to demonstrate our skill and our participation in our patients. So this is a really interesting International Classification of Functioning, Disability, and Health and the World Health Organization decided that they really wanted to talk about that people's limitations are affected by many things in participation. It might, and so they came up with an international classification of functioning. It also helped to decrease some of the bias of the word like disability, and you won't see that here in this international classification, that we talk about participation limitations and restrictions. We don't talk about disabilities anymore. So there are many categories to this. Body functions and structures, that's things like bones and joints and strength. Activities and participation is things like, can the person cook a meal? And what are the environmental factors that could be in the way? For example, maybe the surface of the ground is uneven, and if your patient has poor balance, that's something that needs to be taken into consideration. So that could be a barrier. And then a facilitator might be something like a easy gripper or something that could help to participate to overcome whatever barrier comes out. So we're going to go into this a little bit more. So you can see how all the arrows in this really touch each other. So what they're saying is if you have a patient who has a limitation, let's just say in shoulder range of motion, so that would be a limitation in body structure, they can't reach their shoulder up, then that's going to limit their activity. So they're not going to be able to perhaps reach into their closet or pull open their refrigerator door. And then maybe that means that they can't participate in meal preparation. So you can see how it's all into consideration. Now, an environmental factor that might limit that is the fact that the height of their kitchen shelves, that's going to limit their participation. And then the personal factor is how old the person is, what their relationships are. Are they married? Are they single? So you can see how they all intertwine between each other. So it's not just that one causes the effect of the other, it's that the different parts of this really interact with each other. And so it's important for us as therapists to take into consideration all of these things when we're evaluating a client. So they have broken this down, and we're going to be talking a lot about this as we move into the next, when you are on campus, when we're talking about different injuries and illnesses. We're going to talk about the ICF classification, and we're going to use an ICF checklist. But you can see that this ICF really takes into a lot of conditions as far as body functions, mental, neuromuscular functions, functions of the skin, body structures, everything from the brain to the digestive system to, again, anything that's limited movement. So activities are things like mobility, self-care, interpersonal interactions, community, civil life. So there's a lot of things, as well as just general tasks that need to get done on a daily basis. And then environmental factors can be not only things that are present in the environment, but even attitudes of individuals as well as the individual themselves, their relationship, as well as some services and systems and policies that are in place. So again, the ICF, really, the International Classification of Functioning in the checklist, really wants to talk about the way that all of these different things interact with each other. So just to show you, there are different outcome measures. For example, for body structures and functions, there's a mini mental status examination, which can be a screening tool for cognition. For activity, functional independence measure, otherwise known as the FIMS score, can measure somebody's ability to do functional activities, perhaps after a stroke. And then participation, there's a community integration questionnaire, which is a self-report measure of role function and community activity. So there are many outcome measurement tools that are useful depending on what you're working on with your client. So hopefully this gave you a little bit of an idea of what an outcome measure is and why it's important to measure as well as what are some barriers and what are some of those classification systems that are useful when we're thinking about outcomes. Talk to you soon.